Hey guys, my name is Christine and welcome to my channel. If you did not gather from the title of this video, I did indeed get the COVID-19 vaccine. I got it yesterday. I got the Pfizer vaccine because that is presently the only vaccine that is available within the US, and I'm going to talk about it. Before I get started, I just want to remind everyone this video is not intended to be used for medical advice. I'm not telling anybody what they should or should not be doing. I'm not making a decision for other people. I'm just talking about what my reasons for getting the vaccine were and to tell you guys if I have any side effects, like if I now glow in the dark. A little background on me. I am both a healthcare worker and a chronically ill patient. And to be specific, in my illness, I have a primary immune deficiency. So I'm kind of at the that high risk group of immune compromise that everybody lists about. And yeah, it's unsettling. Anyways, so I'm a healthcare worker. I am a physical therapist. I recently was rehired with a hospital as an inpatient physical therapist. My hospital system was one of the systems that did receive the Pfizer vaccine this week, the first week that I was able to use in the US, and I was given the option as a healthcare worker to get the vaccine. Where does this tie in with being somebody with an immune deficiency? So I have common variable immune deficiency, which is an antibody deficiency. Part of my diagnosis was seeing how I responded to the pneumonia vaccine. And at the time of when they tested my immune system, I failed. I did have some response. So when they tested it, I responded to 4 out of the 14 titers that they tested. So some part of my immune system did work and respond properly, just most of it didn't. So it was still a failure, and it was enough for diagnostic purposes for the CVID. Now, when I asked my immunologist what his thoughts were for me to get this new vaccine, he basically just said, theoretically, it should be safe, but we cannot currently make a recommendation for immune deficient patients because there is no data. So I took that as his politically correct answer. It is true. They have not studied that population yet, unfortunately, with getting the vaccine. It's kind of just like pregnant women. There's no studies as to what this vaccine does to women who are pregnant or breastfeeding. So it makes it really hard for doctors to make a recommendation when they have nothing to go off of for the subpopulation group of people. I personally made the decision, obviously, to get it, and my reasoning was this. The Pfizer vaccine is not a live vaccine. Live vaccines are contraindicated for people with antibody deficiencies because of the risk of actually getting the virus, because my immune system's already kind of a failure. This is not a live vaccine. I work at a job that is high risk of catching COVID. If I worked at a different job or I had the possibility to work from home, I may have made a different decision, may have decided to wait longer. I can't really make that call, but with my job, interacting with patients, interacting with coworkers, a hospital is not a socially distanced place. And yeah, people have masks on, but the risk is still there. So I got the vaccine. My feelings were that even if I just got like a minimal response to it, it's better than having no response, which ultimately I have no clue how my body is going to respond to this vaccine with my immune deficiency. But I'm going to feel much more confident knowing that more than likely I probably at least have some defense mechanism building within my body from the vaccine should I end up getting COVID. Hopefully it will not be as severe or I don't get sick at all. We just don't know I feel like anything is better than nothing. And I also am kind of, just as a side note, super excited about the fact that this is a new type of vaccine. It's a new technology that we've not used. Perhaps my body responds properly to mRNA vaccines. Perhaps other immune deficient people respond properly. Perhaps it doesn't. We don't know. But to me, it's fascinating to think about. Maybe they do have a new type of vaccine technology that we can use that will be useful in immune deficient patients. You know, again, I don't know. I'm not saying that it is, but to me, I think it's exciting, and I think it's just another great stepping stone in medicine as a whole. Unfortunately, we had to go through COVID to get here. As far as the risk of the side effects from the vaccine, did I think about it? Yeah, absolutely. I'm concerned there could be potential long-term side effects of the vaccine itself. However, I am much more petrified of catching COVID and dealing with the long-term side effects of having COVID than I am of the vaccine itself. I would have rather gotten the vaccine than gotten COVID. So, did I faint and go into anaphylactic shock after I had the vaccine? No. Where I got it done, it was all employees. They had us sit for 15 minutes afterwards in this waiting area just to make sure everyone was okay. The time I was there, I didn't see anyone like passing out. Not saying it didn't happen at all. They were out giving us water, snacks. It was actually really nice. The only thing I was told was to make sure you stay very hydrated during the day. I definitely had a very, 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 very sore arm. This is probably the most painful vaccine that I've ever received. The vaccine itself, the shot itself, was not painful at all. I did not feel anything at all from getting the shot. It's more the after pain in my arm that I'm talking about. The only other vaccine in my life that I remember giving me significant arm pain was the tetanus shot that I had when I was, I don't know, like 15 or so. I remember that being pretty painful. The pain kind of like crept up during the day, and last night my arm was definitely very painful. I could probably only abduct it like 30-40 degrees, and getting dressed and undressed was a challenge. And I kept thinking, I'm like, man, I need an OT here to like show me how to get dressed like without using my arm. The pain is still there today. The pain is still bad today, but not as bad as last night. Like I feel the pain now up to here. I could not lift my arm that high last night, but let me lower myself down. Reaching up like that is super painful, you know, whereas my other arm, I can do this. I do feel swelling in the area. It's tender to touch. You can feel it's like, kind of feels like a knot in the area. But other than that, I can't really say I felt any systemic side effects from the vaccine. I did kind of feel some slight nausea and fatigue yesterday, but that's also kind of my baseline of just feeling cruddy. So I don't know if it was related to the vaccine or not. It was nothing significant. I did not feel like I had a fever. I know I didn't have a fever today because I went to the doctor's today and they took my temperature. So I did not feel like I had chills. I did not feel like I wasn't able to get up and walk around. I did not have any of that. But from what I have gathered on the internet, that it is the second dose where people seem to have more severe side effects from the vaccine. So we will wait and see in 3 weeks how I feel after the second one. And before I end this video, I do want to announce for anybody out there who is already starting to get the vaccine that there is a program called vSafe. It's through the CDC, and they are using it as a tracker to see how people do continue to feel after the vaccine. So I signed up for it. Initially, they ask you daily on any symptoms or, you know, just how you're feeling. and it will decrease to weekly. I will admit my arm hurts, but it's getting better. So I would much rather have a sore arm than have COVID. We shall see what happens, and I guess I will give you an update after I get the second dose in 3 weeks, and maybe something in between if I end up growing an antenna out of my head. No, just kidding. Maybe something in between if something else does develop. I did read too, some of the side effects are just a little bit delayed. So we'll see, but other than that, I am feeling perfectly fine right now. No major issues. So that is it, and enjoy your weekend. Bye.